Alright guys, we're going to keep on rolling here. This is my first aid kit that I keep in my bag. I'm not sure where I got the little pouch. I think it come with a fanny pack that I've had for a long time that I don't use because I hate fanny packs. This came with it, and it was in the top of my closet when I found it, so I thought I would turn it into a quick little first aid kit, and I ended up liking it. It holds quite a bit of stuff. Now, I'm not going to do this video like I did the last one with my EDC organizer. I'm going to actually pause the video and pull everything out, lay it out so you can see it, and then I'll explain what I keep in it. Alright guys, this is what's inside of the pouch. Of course, you got your gloves. They're not sterile, but they do offer some protection. This is about 3 pair of just black nitrile gloves. Q-tips for applying some medications, balms and such. You got some alcohol prep pads that I keep in the front of it that are quick access. This that you see right here, and let me remind everyone in case that you're watching this and you don't know, I am a licensed, state licensed and recognized EMT. I do that for a living. So everything that you see right here in front of you, I'm well aware of how to use it. I'm certified in it. I have a good knowledge of how to use it. I use it on a regular basis. So don't think that I just have a bag with a bunch of stuff in it that I don't know how to use. Very proficient with the things that I carry. This is a bite stick. It's just a hard rubber. Looks almost like a tongue depressor. It's for seizure patients. You'd be amazed how many times you go somewhere and someone's having a seizure. There's not really a whole lot you can do for a seizure as far as the medical point of view. You can give medications. All that does is stop the seizure. Most people that have seizures have been diagnosed with some form of epilepsy or condition where they have them regularly. So really the only thing that you can do with someone having a seizure is to prevent them from injuring themselves. So this bite stick is to keep a patient who is actively seizing from biting their tongue or breaking their teeth because they're clenching down on their jaw. That and protecting their neck and their head is the biggest thing that you can do. When they finish seizing, they go to vomit sometimes. Protect their airway, make sure they don't aspirate. And that's really the extent of what you can do with a seizure patient. Of course, keep a pen light. That's just to look at wounds, get a good clear view of it. I always got an extra little light around. They're not extremely bright, but they're not supposed to be. I can check your pupil response. I don't want to blind you with it if I do. Of course, we've got some sterile abdominal pads here, which is just a thicker gauze pad for any kind of traumatic wound. It'll absorb more fluid, more blood. Now in this pouch I've got some smaller sterile gauze. In the back here you can see a tri-bandage. I can do a splint if I need to, say break your collarbone, dislocate your shoulder, anything like that. I can make a sling or a splint with this. Of course I'm not going to drag it all out because there's so much in it. I've got a couple of packages of sterile gauze, got some burn ointment, got some sunblock, bite gel, I've got some Neosporin in here, a couple of sheets of Tagaderm, which are great for skint knees and palms and things like that that children like to get. Of course I've got the dressings, or actually the bandages. These are the dressings, these are the bandages. I've got some different sizes for different size wounds. This is the 6-inch bandages. This is the 1.5 inch. Got to have the tape. Got the ACE wraps, also good for splinting. This is the 2-inch, 3-inch, ankle, elbow, knee, different sizes for different areas of the body. This is a CPR mask. Like I said, I'm an EMT. I'm certified. I know how to use it. This is just a disposable mask in case I don't have my large bag that has my BVM and all of my airway control equipment. I've got this. I can at least do CPR and chest compressions. And that's it for the first aid kit. Of course, I've got tape. I've always got shears in my other bag. Don't really need shears. I can use my pocket knife, anything like that. So rescue shears are just kind of added weight to the pack that I don't want to have to keep with me. But that's my first aid kit that always stays in my backpack. It's always handy. Like I said, when I'm in my wife's car at the church or whatever, you're running around town, I've got a very large duffel bag that I keep in my trunk that is my jump bag. That it's got everything from C-collars, convenience bags, bag valve masks, nasopharyngeal airways, oropharyngeal airways, saw airways, probably a dozen different sizes of these, and trauma sheets. I can't tell you what all's in there without looking, but it's a very extensive bag. I can pretty much maintain anything with that bag. I don't carry medications. As an EMT, even on a paramedic level, you're not allowed to administer medications unless you're under the covering of a company or a volunteer department, unless you want to pay large amounts of insurance to carry it, and it's not worth it. But that's it, guys. That's my first aid kit. Any of you EMTs or just anybody in general, if you've got any comments, anything that you think needs to be added or taken away, let me know. Y'all have a good day.